This year's race to be the Democratic Party's nominee for president highlights some significant differences among the candidates. It generally pits moderates versus progressives. John Hickenlooper tends to be on the more moderate side of the issues. The differences between the two factions seems to be most evident when it comes to their health care plans. Here's more of my interview with John Hickenlooper.
Well, let's get to the issues now. Health care is one where you were very outspoken during the last debate. You opposed those Medicare for all plans you mentioned earlier by Elizabeth Warren and Bernie Sanders being pushed. 2 years ago, you came out with Ohio Governor John Kasich, a Republican, to push a bipartisan plan to tweak the Affordable Care Act. At the time, you got behind that proposal, saying it had a lot of Republican ideas. Recently said, though, you support getting to universal health care. I guess, how do you get there? Does there need to be a public option to do that?
I think there does have to be a public option to get to universal health care, and I've always said that. Even with John Kasich, I was all about, back in the 70s when I was still in college and graduate school, I said health care is a right, not a privilege. I think a public option is the best way to get there, real time, and offers us a pathway to control the inflation of health care costs.
Do Medicare payments to doctors need to increase?
Well, you can't continue to have a system that doesn't pay for itself, and I think there's a legitimate discussion going on is how do we find more resources, especially in rural areas. You see one rural hospital after another either closing down or limiting what services they offer. You know, in Colorado, we saved 12 rural hospitals, and part of when I got elected in 2010, we were 40th in job creation. Now for the last 3 years, we've been the #1 economy, but we've been the #1 economy for the whole state, and I think we're very proud as a state that we didn't leave the rural areas behind, that we will, by the end of next year, we'll have broadband in every city and town in the entire state of Colorado. We'll be the first state in the country to do that.
But in terms of health care, by providing a public option, that is the government paying at that point, certainly that is helping provide that plan, and Medicare necessarily doesn't pay as much as maybe some insurance companies do. So is that something where the government's going to need to pony up some extra money to figure that out?
They've got to figure out exactly what is the compensation, as I was saying, that those resources that are necessary to make sure that, especially in rural areas or low-income communities, where doctors are fairly compensated so that they don't go and do something else. That's the trick, right? And so where does that money come from? My argument is that we are the only industrialized country in the world that doesn't get a bulk discount when we purchase for Medicare or Medicaid from the drug companies. Well, I think they understand that that's not fair any longer. I understand where it came from. There were good reasons 25 years ago when they created that money would be more than enough to provide the public option and to make sure that doctors get paid fairly.
Now, of course, the positions that Elizabeth Warren and Bernie Sanders have is for the Medicare for all situation, and of course that was where the whole issue of private insurance companies and their existence comes into play. Doesn't protecting private insurance companies still give them the right to refuse paying for some treatment? Again, they don't cover everything, and so that's the idea of coverage is to make sure that everyone gets equal access to health care.
I agree, and that is a classic case that has to be negotiated and debated. You immediately will have the Republicans on one side saying you're creating death panels, right? On the other hand, you're having...
Well, the Democrats will argue that insurance companies are death panels.
You certainly hear that, don't you? Both sides are amping up the rhetoric. I think the solution is to get all the different interests, the self-interest, in a room, right? And start out just figuring out, what do we all agree to? Do we all agree to universal health care? Do we all buy into that? I think those types of difficult negotiations, it's the only way we're going to get through health care. It's the only way we're going to get through climate change. It's the only way we're going to get through this workplace disruption of automation and artificial intelligence. All these things require people to work together and figure out compromises.
Your position on this issue is more in line with Joe Biden's. How do you win over his loyalists, or does this make you more attractive as a running mate for him potentially?
Well, I don't think that this is a year where women have been very vocal, and I think
you think a woman should be on the ticket at some point, Rick? If it's not at the top of the ticket, it should be on the bottom.
Exactly.
Of the ticket.
It's hard to imagine that the Democrats won't have a woman on the ticket. And I am a fan of Joe Biden's. Again, you won't hear me criticizing him, but we have had very different, for the last 45 years, he's been in Washington. I've been a small business owner, an entrepreneur, trying to make payrolls, and then as a mayor for 8 years and governor for 8 years. It's just a different background.
John Hickenlooper on health care. Still to come, getting loud about guns. A lot of Democrats make big promises on this issue. What Hickenlooper actually got done when he was governor of Colorado. For the record.